This video is intended to help your clinical reasoning by helping you develop a diagnostic framework for respiratory distress in pediatrics. This should hopefully make it easier to consider differential diagnoses in a more structured way. We'll also discuss some really important examples of cognitive bias, which can result in diagnostic error. Let's start with a case scenario. Imagine that you're a senior resident in the paediatric ward at John Hunter Hospital in Newcastle, Australia, and you have the absolute pleasure of teaching two brand new, out-of-the-box, doe-eye medical students. One of them looks at you with sheer terror, unsure if the myths are true about being grilled on ward rounds and if you might be the one to put them on the barbecue. The other seems far too confident, explaining not only did they do a first aid course and learn how to establish an airway with nothing more than a ballpoint pen, but they've actually also watched all of Grey's Anatomy and Scrubs too. With some concern that one of your students might perform a tracheostomy on an unsuspecting patient, while the other cowers in the supply room, you decide to ask them about their approach to a child with acute respiratory distress and if they have a diagnostic framework. You give an example of a 2-year-old girl with acute dyspnea who presents in the middle of the night. She's recently travelled to Papua New Guinea with her family and was coughing on the flight back yesterday. Your confident student immediately interrupts you and says that the most likely differential is tuberculosis, given it's endemic there. You're kind of slightly taken aback by this, and you ask him to think of a structured set of differentials, and continue to explain that overnight she actually arose with a sudden onset seal-like barky cough and inspiratory stridor at rest. While the other student thinks, the first one sticks to his guns and says TB is still the best diagnosis. And you're surprised by this strange answer, so you decide to teach them your own approach. One differential framework for acute respiratory distress can be imagined by considering a local anatomical approach. Think about the lower respiratory tract, the upper respiratory tract, the heart, and then other causes of dyspnea. You can break this down even further too. For example, the lower airways have a pleural lining, pulmonary vessels, airways, and alveoli. Differentials naturally might include pneumothorax, pulmonary embolism, asthma, or pneumonia. In the same way, you can do this to the heart too. On the other hand, you might just consider only the common and important differentials in each group. For example, common pediatric upper respiratory tract issues can be remembered using the mnemonic bacterial cafe. This stands for bacterial tracheitis, croup, abscess, foreign body, and epiglottitis. Back to our students, you explain the importance of a structured approach, regardless of the strategy you use, and go on to highlight a common form of diagnostic bias the students should be aware of. The overly confident student immediately placed a high diagnostic value on the patient's travel history. He then didn't re-evaluate the likelihood of other differentials, even after being given more information, which might actually just suggest croup. This is known as anchoring bias. Often clinicians don't readjust their original impression after more results come out because they latch onto or anchor on a specific feature. It's quite similar to confirmation bias, where some of the data is given more value when it fits in with your diagnosis, while the data that refutes your diagnosis is actually undervalued. To review, a good diagnostic framework for respiratory distress can be made by considering an anatomical approach to the cardiorespiratory system. Important acute upper airway obstructions can be remembered using bacterial cafe. Finally, diagnostic anchoring can occur if you latch onto a specific feature and don't readjust your differentials given new data. Thanks so much for watching Townsend Teachings. Don't forget to hit the notification bell, like, comment, and subscribe.